it's a fact that human body has more than a trillion cells. Quadrillion bacteria are occupying the spaces on the human body. So these are the bacteria which are occupying the nose, mouth, larynx, trachea, skin, and the intestine. What is a parasite? When bacteria live in association with living things and they are dependent on them for nutrients and a suitable environment. Saprophytes are bacteria that live on dead or decaying organic matter. Pathogenic bacteria, when we talk about pathogenic bacteria, then that means those bacteria that are causing harm to the host or causing disease to the host. Normal flora or commensals, bacteria carried by man in large number. They are useful for man by occupying places on body which can be taken up by disease causing bacteria or pathogenic bacteria. What if this normal flora is killed? Then the useful bacteria, if it is killed in the mouth, fungal infections may occur. If it is killed in the intestine, then diarrhea may occur. Now, before long it was called normal flora, but now the term has changed and we do not use this term flora anymore, and the correct term microbiota is used. Now, it denotes what is normal microbial flora, denotes the population of microorganisms that inhabit the skin and mucous membrane of healthy normal persons, and they permanently occupy certain body sites like skin, oropharynx, colon, and vagina. They have a friendly relationship with the host until some conditions prevail. Viruses, protozoa, and helminths, they are not considered to be members of the normal flora because in any case they are causing disease in a human. So they are basically pathogens. So this is an electron microscopic picture of a skin. You can see the skin pores here and bacteria which is sitting on the surface of the skin. It may be pathogenic, but it may be a normal flora. Now, a microbe can cause, when it is interacting with the human, it can cause disease, it can cause a transient colonization. That means for a little bit of time, it may reside on the human, or it may be a permanent resident on the body. Now, disease by the microbes may be due to microbial characteristics, that means factors, or it can be due to human factors. Now, what is colonization by microbe? It is acquisition of a new organism. Infection is another term which is used for colonization, so it may not imply disease, but rather the association of the microbe with the human host for a time. So this means that colonization by a microbe means that a microbe may be acquired by a human, but it may not cause an infection or disease. It may be causing infection, but not showing the symptoms of the disease. Transient colonization, which is based on the duration of interaction for weeks, months, or years. Now, transient flora, they are potentially pathogenic microorganisms. They inhabit the skin or mucous membrane for hours, days, or weeks. They do not establish permanently on the skin surface, they sporadically multiply on the skin surface. For example, those that are acquired by healthcare workers, Staph aureus, Micrococcus, Diphtheroids, Streptococcus, and gram-negative bacilli. Resident flora, normal flora, they are fixed types of microorganisms regularly found and residing under the superficial cells of the skin, and if they are disturbed, they re-establish themselves. For example, Epidermidis, Propionibacterium, and Corynebacterium. They do not have any pathogenic effect on the skin. So this is just a picture showing a resident bacteria which is there residing for, these are the permanent resident on the skin. There is the transient bacteria. They may stay on the host, but then they leave the host. Now the normal flora may have a symbiotic relation with the host. It can have an opportunistic relation with the host, or it can have no effect, or they are known as commensals. Symbionts usually benefit the person infected. For example, bacteria in the intestine, they assist in the synthesis of vitamin K and some vitamin of the B complex. Opportunists, as the opportunity arises, they become pathogens like Candida, which is a fungus, Clostridium difficile. Or if a commensal or normal flora, they leave the usual habitat and they enter another part of the body where it can establish itself and cause disease. Like E. coli is a normal inhabitant of the intestinal tract, but when it enters the urinary tract, it can cause urinary tract infections. Commensals, largest group of the normal microbial flora, and these are the places where it can stay, and they are neither beneficial nor harmful to the host. But they can protect by competing with the potential pathogens. Now, carrier state is something else which is different from normal flora. An individual may harbor potential pathogens and therefore it can be a source of infection for others. For example, a person with an asymptomatic infection, it may have the pathogenic organism which may not be affecting the individual, or he may have recovered from a disease, but that individual carries the organism and may shed it for a long period of time. For example, Salmonella typhi. A person who is infected with Salmonella typhi may have that bacteria after recovery in its gallbladder, and it may excrete out that bacteria and cause infection to other humans or typhoid to other humans. So this is a picture depicting the importance of normal flora. Here the white ovals, they are the normal flora. They do not allow the pathogenic bacteria, which is the black ovals, to come and invade the mucosal cells or the skin of the host. But when this normal flora is disrupted due to any factors which are written here, then these pathogens then they come and reside on the mucosal surface of the skin. When do normal flora become opportunist? When these are several factors in the host like malnutrition, recurrent infection, immunosuppressives for organ transplant recipients, advanced HIV infection, chemotherapy, cancer, skin damage, antibiotics, treatment for a prolonged period of time, pregnancy, aging, leukopenia. Opportunistic, they are also called nosocomial infection, which are acquired in the hospital setup. Site of normal flora, respiratory tract and head, these are the sites, but the sterile site of the respiratory tract are sinuses, middle ear, brain, lower respiratory tract. These sites, they do not contain any kind of flora. GIT, these are the sites having normal flora. The genitourinary system, the sterile sites are bladder, cervix and uterus. Role of normal flora in the skin, mostly when the skin is dry, it does not support the growth of normal microorganisms, but moist areas may be readily colonized by gram-positive bacteria. Significance of normal flora, protective है, it does not allow the pathogen to reside, and so this is the skin surface which is have a covering of normal flora, and if it is removed, then the pathogen have an opportunity to come and invade it. So this is how you protect against the pathogens. Pros and cons of having normal flora: it prevents colonization by pathogens, secrete these vitamins and B12, stimulate antibody-mediated immune response, kill the pathogens and inhibit the pathogens by production of enzymes. But disadvantages of now having normal flora: they can act as opportunistic pathogens when the conditions arise in the host, gain access to sterile sites, share nutrients and drug resistance with the pathogens, may be a source of infection to other individuals. So these are the normal flora. This is Staph epidermidis, Aureus. Aureus is it is not a normal flora. It may reside. It is a colonizer, especially in the nose, but you cannot say that it's a normal flora. It's basically a pathogen. Epidermidis is a normal flora. Corynebacterium acnes, which is the cause of acne vulgaris. Candida, skin infection. So important points that they are permanent residents of the body, microbiota, and viruses, protozoa, helminths are not normal flora, and they inhabit the body surfaces, does not allow the pathogens to